Over the last year, patients who've got symptoms of perhaps indigestion or tummy pain or problems with their bowels have stayed at home and stayed away. And for lots of those, and they may perhaps had some advice from their GP and their symptoms have gone. But it is a concern that there is a group of patients who are battling on with their symptoms at home and perhaps not getting the help that they may need.
Well, I had sort of bloated, this kind of bloated feeling, like I'd had a big meal, but I had it all the time.
Cramps, my stomach, and quite constipated.
Then I started hiccuping and burping and very unpleasant feeling here.
And I just thought, well, it will take care of itself when I can sort of stop running after the kids.
It's just stress, it's just part of the job. All you need is a good holiday.
We all do it, we all self-diagnose, speculate. A lot of these symptoms can be completely harmless, but without tests, there's no way of telling what's going on. It's all just escalating in your mind.
My uncle had bowel cancer. That really did worry me, because I thought, well, is it hereditary? Is it a family thing?
My doctor said, look, London Clinic, you'll be seen this week or tomorrow.
I had a video consultation. I come in today for the procedure.
The assurance that we give is from the time that you have your booking, then we will tell you everything that you have to do, a step-by-step guide. And we have everything in place to make you feel so safe. You have a wonderful team of the most qualified, skilled and knowledgeable nurses. We are all here to help.
Patients from all over the world get referred to our specialists because both of their expertise and the facilities that we have. So just this morning I was doing endoscopy with some artificial intelligence, which is a special machine that helps me identify growths in the bowel before they become cancerous. Any symptom that you have, your GP or indeed our private GPs here at the London Clinic, they will have seen and heard of before. And it's our daily conversation to talk about your tummy and your bowels.
Endoscopy was all right, The doc talks with you all the time. And he said, you haven't got cancer. You haven't got cancer. For half a year, maybe longer. That's what I've been worried about.
The doctors tell me there's nothing seriously wrong, but they're going to look into perhaps that I have IBS.
The majority of times, of course, you'll be reassured with some simple medicines or advice, but if you do need to have surgery, we have a number of expert surgeons who we can refer to, who we work with very closely, and of course other specialists. It might be a dietitian, for example, and that would all be in-house, all within the same facility.
They diagnosed me with stomach cancer. Immediately after that, it was just a definite, right, this is what we found, this is what the plan is, and this is when we're going to do it. In some ways, I've been lucky because it was caught early. Time is precious.
Put myself through all this worry and, you might as well just ask an expert.